Hello everyone, Assalamu alaikum. I am Dr. Abdur Rahman Rana, Assistant Professor, Department of Pharmacology and Therapeutics at the Akij Medical College, Boyra, Khulna. My today's topic is about placebo medicine and excipients. Now, what is placebo medicine? A placebo medicine is a component of therapy that is without a specific biological activity for the condition being treated. What are the criteria of placebo medicine? The criteria of placebo medicine is it is made to match ingredients, the active treatment as closely as possible regarding the actual size, shape, color, texture, weight, taste and smell of the drug. In case of placebo medicine, all treatments have a psychological component. The main theme is to please the patient. This is placebo effect. A placebo medicine is a vehicle for cure by suggestion, and it is surprisingly often successful when it is given only temporary. Then what are the use of placebo medicine? Mainly it is used to benefit or please a patient, not only by any pharmacological action but also used for the psychological reason, and it is also for the control in scientific evaluation of the drug. Also, the use of the placebo is for the treatment of drug addicted patient, to avoid the false conclusion of the drug, to distinguish the drug effect from natural fluctuation in disease that occurs with time, to determine the effectiveness of standard drug therapy, to know the severity of disease, to know the length and objectives of the clinical trial, to detect the novel drugs gives only the symptomatic relief. And that is all about the usage of the placebo medicine. Now, what is excipients? Excipients are the additional chemical agents that are used in drug production having no drug property. Then what are the components of excipients? There are various components of the excipients, that are diluents, binders, disintegrating agent, lubricants, coloring agent, sweetening agent and flavoring agent. What do you mean by diluents? Dilute means this is the pharmacologically inert substance. It forms the bulk of the drug. The example of the diluents are dextrose, lactose, starch, sucrose, etc. The diluents are the pharmacologically inert substance. It mainly form the bulk of the drug, means the size of the drug, shape of the drug. The aim of the diluents used in the excipients is it is impossible to make the main drug. As for example, when we make 0.25 milligram digoxin, it is very difficult to make the 0.25 milligram digoxin without adding the excipients. That's why we use diluents to make the 0.25 milligram digoxin. Usually dextrose and starch and crystalline cellulose usually used, and main use is crystalline cellulose and lactose due to compatibility and uniformity of supply and also solubility of the lactose. Now binders. The substance is used to cause addition of the powder molecule in tablet and granules. They bind the several drug molecules to prevent auto breakdown. To prevent auto breakdown is called shelf life. Usually binders is used is methyl cellulose. Now disintegrating agent. The main disintegrating agents are starch, vegam, corn. The main theme is to break the drug molecule before absorption. That's why disintegrating agents are used. Now lubricant. The lubricant used to lubricate the drug molecule. What are the lubricant? Stearic acid, calcium stearate, magnesium stearate, zinc, talc, mineral oil are the lubricant. Then coloring agent. What are the coloring agent or main theme of coloring agent? The main purpose of use of coloring agent as an excipient is to color the drug molecule for identification and attraction. Example of the coloring agents are indigoline, first grain, erythrocin, tetrazine, brilliant blue, caramel, etc. Then sweetening agent. The main purpose of the sweetening agent is to make the drug for sweet taste. The example is sweetening agent is saccharin, lactose, mannitol, etc. Then flavoring agent. The main purpose is to flavor the drug molecule for better attraction of the patient. As for example of the flavoring agents is orange flavor, peppermint oil, etc. Thank you all for watching my today's lecture. আসসালামু আলাইকুম।